Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello. This is Dr. Shashidar Manchala. I'm a consultant neurologist and movement research specialist from Hyderabad. I'm
Yeah.
working in Medicover Hospital, Begumpet, from Hyderabad. So, hi, everybody who are interested to know something about epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
First thing, seizure and epilepsy both are different. So, nowadays, people are using these two terms, seizure and epilepsy, interchangeable. Okay.
Yeah.
So, first, I'll come to a seizure. So in seizure, what happens? So in all our brains, some electrical activity will be there. With that electrical activity only, our brain controls entire work of the body. So
Yeah.
any part of the brain produces abnormal electrical activity or excessive electrical activity, so which causes uh, symptoms of seizures. So many people knows those involuntary movements. Those are all the symptoms of seizures. So abnormal excessive electrical activity from a part of brain causes seizure.
What is epilepsy?
Yeah, coming to epilepsy, so it's a group of seizures. So in this, two or more seizure episodes,
Yeah.
the time gap between these two seizure episodes are is 20, more than 24 hours, and it should be unprovoked seizures. So that means the cause should not be there.
Yeah.
Okay. So
Yeah.
symptomatic epilepsy, those are I'll explain in your later questions. So it should be a group of seizures 24 hours apart and unprovoked seizures called epilepsy. So
Okay.
all epilepsies are seizures, but all seizures are not epilepsy. Is it
Got
clear?
it.
What are the different types of seizures and do they affect people differently?
Yeah. So first thing, so seizures or epilepsy is not a very uncommon thing. So in general population, general people see seizure means sudden onset, some involuntary movements. Involuntary
Yeah.
movements upper means hands, legs, or head, frothing from mouth. People think
Yeah.
only these are seizures, but so many types of seizures are there. Broadly, this classification is simple seizures, generalized seizures, and unspecified seizures, and status epilepticus. We can call it. So in simple or focal seizures, we can say focal seizures. Any
Yeah.
seizures which involves a part of body. It can be face, or it can be your hand, it can be your leg. So that is focal, only localized seizure.
Yeah. Yeah.
What we see in outside general population, so that is generalized seizures. The entire body involves in that. So in that, involuntary movements we will see. So that is generalized seizures. And unspecified seizure means so many mixture of focal, generalized, so many types of movements will be there. So that is unspecified seizures. And status epilepticus means seizure which continues more than 5 minutes without regaining consciousness in between. So
Yeah.
that is status epilepticus. So these are different type of seizures broadly.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No. In epilepsy, almost 60 to 70% we won't get any cause. So I
Mm-hmm.
already told you there is excessive abnormal electrical activity from a part of brain.
Yeah.
So example we can say if there is any damage in the brain, so
Mm-hmm.
that produces excessive electrical activity. So the causes, so many causes are there. So I'll tell you some common causes.
Yeah,
So
sure.
if some any infection in the brain
Mm-hmm.
which involves the brain parenchyma, mainly cortex, it
Okay.
produces seizures or epilepsy. Okay.
Yeah.
Second, any strokes, that is cerebrovascular accidents. In that brain, some part of brain will be damaged, so it that damaged area can produce seizures. Then
Yeah.
some metabolic causes like hypoglycemia and hyponatremia, like metabolic causes also causes infections, strokes, metabolic causes,
Yeah.
and a traumatic, post traumatic also there will be damage in the brain parts, so it can cause these seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, so it depends upon the classification what I told you. Say
Mm-hmm.
focal seizures, so that is a single part of our body affects with this seizure symptoms. The
Yeah.
some involuntary movements involving example head
Mm-hmm.
or hand or leg, so that is a
Yeah.
focal seizures. If it is generalized means usual everybody means general population knows the seizure, what is seizure means. It is like involuntary movements of both upper limbs and lower limbs, with frothing from mouth, and
Yeah.
sometimes urinary and blood bowel incontinence in the clothes, so this will happen.
Okay. Got it.
And
Yeah.
I'll add some more thing. So
Sure.
in other classification also there, so
Mm-hmm.
it depends upon which part of the brain is producing this excess electrical activity.
Yeah.
So in brain sensory area, motor area are different parts are there. If motor area, so which controls our movements, power, all these things, so if that part affects, so we'll get that involuntary movements. If any sensory part, sensory means touch, pains, and these are all sensations. If that
Yeah.
sensory cortex involves, then patient feels just like something crawling uh, on face or legs or hands also, so that is also a seizure.
Okay.
Okay, it depends upon which area is producing this electrical activity.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, a country like India, so many rural places, in urban places also, some people thinks it is a communicable disease.
Yeah.
Some in rural areas, some different types of seizures are there. So in some seizure types, patients will be, there is a transient behavioral changes. So by seeing that, people will say it's like some ghost entered into his body. And some in some communities they'll avoid marriages also.
Yeah.
Yeah, so these are stigma in India.
Definitely.
So with this YouTube time, so with the social media, so people are becoming aware,
Yeah.
but still stigma regard means about this epilepsy is still there,
Hmm. Okay.
but it's not a
So,
communicable disease.
How does this stigma affect people with epilepsy?
So some part of in our India and some communities, people, I already told you, they avoid these marriages. And in schools also, in some for some patients they have to take so many medications for these seizures. So by taking these medications long term, so they'll have low self esteem, and low confidence also. So
Yeah.
these are the stigma. That's it. Okay.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah. First thing, seizure. Seizure means you have to go to a doctor first, a neurologist who is trained in epilepsies, handling
Yeah.
epilepsies, and you have to start treatment. First, you have to find the cause of the seizure episode, and you have to start treatment accordingly. It depends upon which type of seizures.
Yeah.
Then you have to stick to the treatment. Adherence, that is adherence to the treatment. Timely medication intake is very very important in these to control these epilepsy.
Yeah.
Yeah, and we have to avoid so many daily habits in this epilepsy patients,
Yeah.
like avoiding flashlights, sleep deprivation also we have to avoid, and excessive stress also can cause seizures.
Yeah.
So we have to avoid these things.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yeah. Lifestyle adjustments means a healthy lifestyle. So that includes um, daily a minimum of 30 minutes of daily exercises like walking, jogging,
Yeah.
and timely food intake with timely medication intake. Avoid mobile in evenings or in nights in dark uh, places means switching off all the lights and seeing mobile, watching mobile mainly uh, before going to sleep. So many
Yeah.
people, it's everybody. Okay,
Yeah.
so better to avoid before going to sleep. Better to avoid mobile.
Okay.
Yeah.
Okay.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, safety means do not take seizure episode, single seizure episode also. So something is going wrong in your body. So better to consult a doctor. First thing, find out the cause.
Yeah.
Then take treatment properly because brain is the only organ. Once damaged means it is damaged forever.
Yeah.
So seizure can cause damage in brain cells. So it's better to go to a specialist and start treatment.
Yeah.
The adherence is very very important in seizure epilepsy treatment. Timely tablets or medication intake is very very important, and lifestyle modifications, proper sleep is very important,
Yeah.
and nighttime mobile watching for a long time, especially just before going to sleep, and you should, if you want to see the mobiles, so under proper lighting.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, so many patients comes to our OPDs. So they ask one question,
Yeah.
sir, why am I the only person affected? This thing, uh, how many patients you have seen? So many patients ask us. So in the world by 2020-22,
Yeah.
70 million people are affected by epilepsy. In India
Yeah.
itself, 12 million people are affected with epilepsy. You are not alone. With proper medication, is epilepsy is very well controlled. Nowadays, so many surgeries also came for
Yeah.
epilepsies. Brain surgeries also we can. treat epilepsies, at least we can reduce the burden of medications also.
Yeah.
First thing we have to find out the cause, and adherence to medications is very 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 important. This is not a communicable disease. If we take proper timely treatment,
Yeah.
so we can control seizures and we can stop those seizure episodes.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.